It's been more than a year since the coronavirus was first declared a pandemic, and many right here in Arkansas are still feeling the effects of the virus. Some so-called COVID long haulers have lasting symptoms long after their diagnosis. Katrin Asaf has more on what we're still learning from the coronavirus.
From the peak of the pandemic to this week's low numbers, North Little Rock doctor Stan Keller has seen it all.
It was really bad August through about 6 weeks ago.
His team at Baptist Health have tirelessly worked through COVID-19, but the disease is far from over.
We still think of acute COVID as under 4 weeks. There's this intermediate 4 weeks to 12 weeks persistent symptoms, and then the long haulers are over 12 weeks.
These so-called COVID long haulers are people who have experienced symptoms for months following the virus, and they're not just patients.
I unfortunately did contract COVID.
Area doctor Julie Gardner got the virus in November after nearly a year of strict precautions and careful planning. Now, 5 months later, she's still seeing the effects.
I'm followed by a cardiologist now for the heart issues that have developed. I've had some issues with my vision.
Similar symptoms to what Dr. Keller has seen as a lung specialist.
Persistent cough in some individuals, persistent shortness of breath.
The need is so great that Baptist Health is planning on opening a post-COVID clinic for those with prolonged symptoms. According to Gardner, the evolution of this virus proves there's still much unknown.
I think we're learning that we have a lot to learn yet.
And from someone who's had COVID, she has some advice.
Get the vaccine.